All right. Our next presenter is Sandra Sanderson. She will be talking about the lymphatic system. Sandy is a physical therapist and a certified lymphedema therapist. After several years practicing as a physical therapist, she decided to study lymphatics. She has over 14 years of experience treating people with lymphedema. Her focus is on all aspects of breast cancer rehabilitation. She is also certified by the Lymphatics Association of North America. Outside of work, Sandy's interests include exercising, gardening, cooking, walking, and agility with her dog Sasha. It is my honor to introduce Sandra.
Thank you, Meg. Thank you for allowing me to present on the lymphatic system. Today, I really want to review the history and how they discovered the lymphatics, an overview of the entire lymphatic system, any conditions that can affect how the lymphatic system works, and then the cancers and the omentectomy and how that can relate to lymphedema, and also empower our cancer survivors. So with the discovery of the lymphatic system, we begin with Hippocrates, who described the vessels as containing white blood. And Aristotle spoke of the vessels holding a colorless fluid. Along comes Jean Piquet, who described the cisterna chyli and the presence of the valves within the lymphatics. He also talked about the communication between the thoracic duct, which is the longest duct in the body, with the left subclavian vein. Anton Nook, in the 1600s, actually injected mercury intralymphatically so he could see the outline of the lymphatic system. But through time, modern technologies, CT scans, lymphographic imaging techniques allow us to gain a better detailed picture of the lymph system and also learn more about it. So what is the lymphatic system? Basically, it's a network of tissues and vessels and organs that all work together to move your lymph fluid back into your bloodstream. The lymphatic load, or what the contents of this, include protein molecules, fats, minerals, nutrients, bacteria, damaged cells, and cancer cells. There are also lymphocytes, which are the white blood cells, which transport the infection-fighting cells. The thoracic duct, which is the longest duct in the body, originates together with that cisterna chyli. You can see those in the slide. The cisterna chyli actually collects all of the lymph from the lower extremities, the abdominal, and the gastrointestinal region. And then it actually empties into that thoracic duct. The thoracic duct perforates the diaphragm as it makes its way up to the left subclavian vein, or the venous angle. Two other organs that we can see also is the spleen, which acts as a filter for your blood, and it also fights invading pathogens. And lastly, the thymus gland helps the body protect against autoimmunity. It plays a vital role in the lymphatic system and the endocrine system. So here we can see the cardiovascular and lymphatic system. The cardiovascular involves the functioning of the heart, the blood, and all the vessels that supply oxygen and nutrients to the organs throughout the body. It also is responsible for removing waste products through the veins. Then you have your lymphatic system. This is part of your immune system, which protects your body against the foreign invaders, the maintaining body fluid levels, also absorbs all of those digestive fluids and helps with removing the cellular waste. There are some differences though. Even though they're intertwined, the lymph system is a one-way deal. starts at the fingers and the toes, and the vessels carry the lymph fluid to a lymph node and it's filtered. It goes to another lymph node and it's filtered until it becomes clean. There is no central pump in the lymphatic system like there is with the circulatory system. The heart is the pump for their cardiovascular, whereas the lymph system, basically, it's a transport system. It's kind of a, it just kind of goes in one direction only. There is no circulation, and it dumps into the vascular system ultimately in the end. So let's talk about the vessels and how it moves the fluid itself. The lymph vessels actually have a similar structure to the veins in that they have valves that open and close to move either the blood or the lymph fluid. If you look at the circle in the center, there's a higher pressure of interstitial fluid outside of that green finger-like projection. That's the lymph capillary. So when you have a lot of fluid on the outside, it actually tugs on those little strings or anchoring filaments. It's the valve, actually the fluid leaks then into that valve, and that valve will close only when the pressure on the outside equalizes the pressure on the inside. So then you have pre-collectors, which connects the lymph capillaries and the collectors. The collectors have those valves which allow the fluid only to travel in one direction. That segment between the collector and the valve is called the lymphangion. The lymphangions are actually how the fluid moves, and they have an autonomic contraction frequency of 10 to 12 contractions a minute. We call that a big fancy word, lymphangiomotoricity. So the lymph fluid is now moved in that lymphangion, and it brings it to a lymph node. So what do the lymph nodes do? They have three main functions. Protective, as they filter all of the harmful bacterias, pathogens, cancer cells, dust, and dirt, which is contained in the lymph fluid. Also, there's an immune function. Those lymph nodes produce the lymphocytes, which are the white blood cells, which are circulated in the blood in the lymphatic system. They fight those foreign invaders. The antibodies actually leave the lymph node through the efferent lymph vessels. You can see on the right side of the picture. The third function is the thickening of the lymph fluid. So now you have blood capillaries, which are inside the lymph node, that actually resorb a lot of the water in the lymph fluid. If you look on the left part of the lymph node, you can see many afferent lymphatic vessels bringing the fluid into the node to get filtered. Some of that fluid is resorbed, and also it's filtered. And then when it goes out of the lymph node, the efferent vessels, there are less of it, but it also has a lot of antibodies that can fight for us. In our body, we have about 600 to 700 lymph nodes. Most are located in our intestine and the head and neck areas because this is a place of entry for pathogens. We have 20 liters of plasma which flow through our body artery every single day in the smaller blood vessels, in the capillaries. 17 liters are actually returned by the way of our circulatory system. Our veins are going to remove the waste. Our arteries are going to bring down those great nutrients to all the body's cells and tissues. The remaining 3 liters seep through the lymph capillaries into our body's tissues. Our lymphatic system collects that with those lymph capillaries we just talked about, and any of that excess fluid is moved to the tissues in the body, and ultimately it returns it to the bloodstream. So now we have some ways to treat lymphedema. Now that we know what it is and how it moves, the development of complete decongestive therapy was founded by a couple of well-known folks. The first surgeon from Australia, Winnie Warder, he actually treated the swollen limbs by elevating, compression, and a special massage. Along comes Emil Vater, He manipulated the nodes with patients who had colds and sinus infections. He had some pretty good results. He went to Paris to further his research, and now he calls his technique lymph drainage massage. Nobody was really accepting of his work. But then along comes the German physician Asdank. He knew of Vater's teachings and techniques, and he actually established the first school for manual lymph drainage in Germany. Emil Vater, his wife, and Astrid were instructors. They had a few differences. Emil Vater moved on to Austria and he started his own school. The combination of all of these great scientists and doctors and their knowledge and research ultimately led to the technique that we use today called complete decongestive therapy. We can't forget about Feudy, who founded his own school for lymphology and phlebology in Freiburg, Germany in 1981. That's a very famous place that a lot of folks from all over the world visit. So we talk about how do we treat lymphedema? The goal basically is to reduce all of that lymph fluid and get it to your arm or your leg or other body part to as near normal state as it was before the fluid came about. It utilizes the remaining lymph vessels and other pathways. We have 4 components: manual lymph drainage, which is that gentle skin stretch, which manipulates those little anchoring filaments we talked about earlier of those capillaries, and it helps with the smooth muscle in the wall of the lymphangion. So each stroke is about 1 second long. You have a working stroke and then a resting stroke. Ultimately, with our hands, we're able to manipulate that lymph fluid around blocked areas, redirect it into a different direction to where more healthier lymph nodes are. Basically, manual lymph drainage speeds up the movement of the lymph. Next is compression therapy. If you have an arm or a leg that are quite swollen, really, really swollen, we may need to reduce them first with short stretch bandages. These are not like ACE wraps, but they have a very short stretch ability and they are layered instead of really tightly woven around the leg. They're applied to the swollen areas. They reduce the lymph fluid by increasing the tissue pressure. We also have decongestant exercises. Specific movements of the arms and legs can assist in the lymphatic drainage as well as diaphragmatic breathing in the trunk. Good hygiene and proper lotioning are also great for skincare. So we have many conditions that can affect the lymphatic system. Enlarged lymph nodes could be infection or inflammation or cancers. Lymphedema, which is actually a protein-rich fluid, which can result from blockage in the lymph system, causes scar tissue, radiation, fibrosis, or removal of the nodes with people who have had surgery to remove cancer, any kind of cardiovascular insufficiencies, trauma, crush injuries, infections, or some causes. Cancerous tumors themselves can actually block the lymphatic ducts or any of the nearby lymph nodes, and they can interfere with the lymph flow through the node. And we have other lymphatic problems that we don't discuss here, but can also occur. So when we talk about ovarian cancer specifically, the omentectomy is a surgical procedure to remove the omentum. The omentum is just a thin fold of abdominal tissue, which encases the stomach, large intestine, and the other abdominal organs. This fatty lining contains the lymph nodes and lymph vessels, the nerves, and the blood vessels. With ovarian cancer, the omentectomy is performed along with a hysterectomy, removing the uterus, the oophorectomy to remove the ovaries, and or a salpingectomy to remove the fallopian tubes. The omentectomy is performed since cancer can hide in the omentum. The removal reduces the risk of cancer spreading to stomach and other abdominal organs. So as Dr. Stotz discussed in her presentation on the greater omentum, it is the policeman of the abdomen. I'm going to touch briefly upon this. The omentum consists of 4 different regions. It's basically a framework of the loose connective tissue where the blood vessels are embedded. It has perivascular adipose or fat tissues. There's a net-like arrangement of collagen fibers. And lastly, the omentum associated lymphoid tissue, or OLT, known as milky spots. The OLT has numerous macrophage, the little eaters, and the lymphocytes, which act as filters through which the lymph and the other substances are absorbed. It also participates in the immune defense of the peritoneal cavity, and this also can be a site of the peritoneal metastases. So with ovarian cancer and some other cancer types, the omentum is removed along with the other female reproductive organs. So what can happen? The surgical site can leave intra-abdominal scarring, which can equal pain. We can also have lymphedema in the abdomen due to the disruption of the normal lymphatic flow. There's impaired peritoneal defense mechanisms, and also, since the omentum is very closely related to the stomach and the gastric lymphatic drainage, we can have digestive issues. There's also nerve impairments that can occur. So abdominal lymphedema is an unfortunate side effect. There's really little information known about the abdomen, the abdominal lymphedema, but more on the extremities, as we can visualize the arms and legs enlarged more so than we can the stomach. We can treat arm and leg lymphedema with compression garments, but compressing the abdomen to reduce the fluid isn't really that appealing or that comfortable. The surgical removal of the omentum and all the associated lymph nodes in the abdomen really can't be avoided. The region contains numerous nodes that are attached to other organs. So when we remove them, we're actually disrupting the normal lymphatic flow, thus causing a whole lot of fluid retention and bloating. So how it works, now that you know what the lymph vessels do and the lymph nodes, when you remove the lymph nodes, those lymph angions, those little vessels that transport the fluid to the node, they actually suffer a backup of lymph fluid. Remember, we had protein molecules contained in that lymph fluid? Well, unfortunately, they love water. So they are there looking for little water molecules to hook onto. And when that happens, you get this abdominal bloating. This also increases the fluid throughout the peritoneum. This same phenomenon can occur anywhere in the body when you have lymph nodes removed. Another cause of abdominal lymphedema can be ingesting too many salty foods, which increases the fluid retention. So thus, lowering your salt intake is helpful to control your bloating. So how can I keep my lymph system healthy? Exercising daily will help with weight reduction. It improves our energy and our mood, also improves our immune function. Our overall muscle health is improved, as well as the circulation of the blood and the lymph fluid transport. Diaphragmatic breathing is a specific breathing technique that encourages the abdomen to rise up more than the chest. It actually helps suck the fluid from the lower extremities and that digestive system upward through the thoracic duct. Every time we breathe, we're actually sucking lymphatic fluid from the lower leg and the abdomen. It allows it to be returned to the venous angle of the vascular system. Earlier, we talked about manual lymphatic drainage. You can visit a certified lymphedema therapist who can perform this technique. There are superficial and deep drainage techniques. You can also be instructed on these as methods of a way of controlling your own lymphedema, a way of self-manual lymph drainage. And lastly, elastic taping. The properties of the tape actually pull on the anchoring filaments, and they create the slow, smooth stretch on the lymph collector. So you constantly have this movement of lymph fluid. You can actually decongest a congested area very rapidly. It helps the lymph angions contract and move that fluid faster. I believe that there will be more information later on describing how I can keep my lymph system healthy with other presenters. So we have additional resources I'm listed there as a contact. Also, if you would like to locate a therapist near you, it's best to check out some of the schools that have certification for lymphedema therapists. It has to be an intensive 135-hour course. The Academy for Lymphatic Studies, the Vodder School, Close, and the Norton School. There's also the Directory of LANA, which is Lymphatics Association of North America, and the National Lymphedema Network also has a listing. There's also a textbook for clinicians, everything that you should know about lymphedema. It's entitled Lymphedema Management, the Comprehensive Guide for Practitioners. Joe Zuther and Steve Norton are the authors. So thank you so much for allowing me to talk about the lymphatic system. I hope that this was a wealth of information, and please feel free to reach out to me at any time if you have any questions. Thank you again.
Thank you very much, Sandy.